Alright, so last pathology I want to talk about real quick is called a slap tear. And we see this a lot with people who do a lot of things overhead. Again, you can kind of see the pattern here. Overhead athletes and people that do things that require overhead movement, you're just at more risk, you're more vulnerable, and I'll show you why. So this is called a slap tear. Here's what it stands for: superior, labral, anterior, posterior tear. So the problem, well, this is first of all a side view. Can't see this here, but this is the acromion process, this is the cricoid process, the clavicle, and this is the glenoid fossa, so we can see the cavity there. The problem lies with the labrum. The labrum is basically a gelatin material that encircles the glenoid cavity, and it basically deepens this cavity right here. It is going to allow the humerus, which is larger than the cavity, to provide some suction and some just some lubricant abilities so that it can slide easily as such. And it would be very painful if we had no labrum. We would be more bone on bone, and that would not be good. Of course, we have the synovial fluid and things like that, but it's coming out at us, and so it's really creating a nice protective, cushiony kind of feel. So here's the issue for our overhead athletes. When they go to elevate their arm, either in an abduction or flexion or what have you, here's what I want you to do. Pitchers will start with their knuckles facing down, because that's the way they break their arms. So if you put both of your hands in front of you, knuckles facing down, and then just raise your shoulder into abduction. How far can you get before you can't move it anymore? You have to keep your knuckles faced directly in front. You should only be able to get somewhere between 60 and 90 degrees. So what's going to happen is that when a pitcher or a volleyball player who's going to spike, or what have you, when they go to actually completely elevate their arm like this, watch what happens. This greater tubercle is impinging on that acromion process. The only way for this to completely elevate is for this humerus to externally rotate in this direction so that the greater tubercle can get out of the way and the humerus can clear the acromion process. That's what has to happen. So a pitcher has to have really strong stabilizers. They're going to externally rotate their shoulder a lot, to the point of injury sometimes. And what actually happens is that there's a bicep tendon, I'm going to take away the humerus for a second, that attaches to this labrum right here. And when the shoulder externally rotates this way, so you can see this way, that bicep is being stretched backwards in the posterior direction. So much so that this bicep will actually tear off in the posterior aspect of the labrum, and it will cause a tear, usually right in this area. A study said with there were 102 patients and a type 2 slap tear, and 44 were pitchers. 81% had some sort of posterior compartment tear, and that's where it's occurring because of that extreme external rotation that pitchers have to be able to produce. That's where a lot of these tears are coming from. It's a very painful injury. So as PTs, we have to do a number of things. Number one, we have to strengthen the bicep tendon. And this muscle we talked about earlier, the subscapularis, is the strongest stabilizer in the rotator cuff group. That's got to get strengthened because as this externally rotates, this has got to be able to stabilize that external rotation. So we're really focusing on those kinds of areas with our pitchers and our volleyball players and so forth. So these are just some things to be aware of as a PT. Just thank you for watching, and see you in another one hopefully.